This organization is relentlessly about the patient. If you're always about the patient, everything else will fall in line. I'm Ed MacLaughlin. I practice on the eastern shore of Maryland, which, if you're not familiar with Maryland, is bisected by the Chesapeake Bay. So I was the first rheumatologist in the area. We've now grown to 3 rheumatologists, 2 APPs, another primary care physician that we've retrained as a metabolic bone disease expert. And we're actually one of the larger practices in all of AARA Bendcare. They have never told me how to manage my patients. They've made suggestions about you might want to do this, but they've never said you must do this. The one must is we all have to be in the same EHR, which is, to me, is a plus. But other than that, they've never told me what to do. So I wouldn't have believed that at first. That was part of the thing I had to overcome, that all these good things would happen and nobody was going to order me to do anything. I didn't change the number of patients I see or how I practice medicine. Just I got reimbursed better for it. And now I'm entering into a database where I'm going to see which medicines work the best and what's the best care we can give. Went into it gently, with a long-term approach, so that we started with infliximab, medicine we knew we're already using, but is used in other disease states, not in rheumatology. And that way it was already in our skill set. Then we gradually branched out. Our infusion centers have already been fully trained, working with the company that's making the product so that we're up to speed. Our nurses and our staff like it because they get to learn about other disease states, other medications. They're up in the forefront of medical practice. So they're actually happy. It actually increases their professionalism and their skill sets. My retirement plans 10 years ago were I was never going to pay off my house mortgage, and I was never going to pay off my mortgage from my office. And I was going to sell my house and move into a tract house and just sort of live very modestly. Now my office is paid for, my home is paid for, I've got some money in the bank, and I look forward to the future with confidence. When we go for pay performance, we'll be okay and we're solid. So that's all the things this organization has done for me. So it's changed my entire outlook of what I'm doing over the next 10 years of my life. So I would ask any rheumatologist looking at this, if they're considering joining us, I would really say, you've got to tell me why you wouldn't want to join us. Really, now that I've done it, I've been in for 5 years, and it's just been a rip-roaring success.